Hello, and welcome to the KCSA Mental Health Virtual Investor Conference. My name is Allison Sauce, and on behalf of KCSA Strategic Communications, as well as our co-host, the OTC Markets Group, we're very pleased you have joined us for our next live presentation from Field Trip Health and Wellness. Before I introduce our speaker, a few points to note. Please submit your questions in the question box to the left of the slides. If you're interested in scheduling a meeting with Field Trip, please click on the Meetings tab on the left navigation bar. You will be able to view the company's availability and submit a meeting request. On a final note, all of today's presentations will be recorded and available for 24/7 replay. At this point, I am very pleased to welcome Ronan Levy, founder and CEO of Field Trip Health and Wellness Limited, which trades on the OTC market under the symbol FTHWF and on the TSX under the symbol FTHW. Welcome, Ronan.
Thank you. Thank you for having me. Thank you, everyone, for tuning into this investor conference. It is my sincere hope by the end of this next 30 minutes that you'll have learned a little bit about Field Trip and our vision and exactly what we're doing in the emerging mental health and psychedelics field, and just more broadly have walked away learning something, or at least seeing the world from a slightly different perspective than you may be looking at it right now. So with that said, I would be delighted to introduce you to Field Trip. So at Field Trip Health and Wellness, our mission is to help more people around the world consciously, safely, and responsibly open up to a new world of possibilities through psychedelics and psychedelic-assisted therapies. And even though mission statements can be grandiose and not necessarily provide a lot of insight into an investing decision, I actually do want to stop and pause on this particular point for a second, because I do think it is important for understanding our vision of the world and our strategy to execute within it. So what you'll note here is that we are taking a multi-tiered approach to mental health and well-being from a psychedelic perspective. By and large, conventional psychiatry has been a failure to achieve its laudable goals. We just have to look at the numbers, and I'm sure if you're in the midst of a mental health conference, you'll have seen the numbers over and over that we're in the midst of a mental health crisis. 1 in 4 people globally around the world are going to experience depression or anxiety on some clinical level at some point in their lives, and current approaches aren't working terribly effectively. From our perspective, the challenge lies not just in psychiatry and the drugs we're using and the approaches we're using. It is based in the mentality of taking an intervention-based approach to mental health. This is where I think the crux of the issues lie, that we think it can be cured like an infection or some other disease that can be treated on an interventional basis, and then everything gets back to normal. And I think what we're learning throughout the last 100 years of research and evidence around that is that by and large is not working, that the number of people suffering with mental health issues is accelerating faster than the rate we can treat them. So there's a disconnect there. And that thinking is the foundation for what you'll see about how we're approaching it from a Field Trip Health and Wellness perspective. But before we get there, let's talk about the market potential of the emerging psychedelic space. And while it certainly has been a challenging year in the capital markets for psychedelics companies, there is an incredible reason to be optimistic about the future from an investing perspective. The estimates on the potential market size for psychedelics have been put in the range of between $400 billion to $500 billion annually in the US alone. Now, those are very big numbers, massive numbers, but the reason, if you look at the analyst reports, these numbers came out of H.C. Wainwright and Roth Capital analyst reports. The reason these numbers are so big is because so many people in the US and globally are being underserved or not served at all by conventional approaches. And when you look at the data around psychedelic assisted therapies and psychedelics broadly, they're showing such incredible efficacy and safety profiles that it's very easy to expect that psychedelics are going to become a predominant form of mental health care in the future. And that's where these numbers come from. The estimates, as you'll see, are backed on by the fact that it's estimated that 80 million people in the US alone are being underserved by conventional treatment. 100 million people around the world experience treatment-resistant depression. It's estimated that by 2040, there are going to be 120 million psychedelic-assisted therapy sessions delivered, which creates a market that is 5 times larger than the current market for oncology. These numbers are huge. There's no doubt about that. And even if they are significant exaggeration to where the market ends up, we still see that the market potential is massive relative to where we are. And because the market conditions have been so challenging over the last year, there's actually an incredible opportunity to invest in good companies with smart strategies that have been undervalued for a long time, because many of the psychedelic companies right now, including Field Trip Health and Wellness, are trading at or below cash value. So there's an opportunity to invest essentially at no enterprise value in this industry, and the market potential is so significant. So how is our approach at Field Trip potentially different from some of the approaches you may be hearing during this conference and abroad? Well, our approach is different because we're not taking an intervention-based approach to psychedelic therapies or mental health. We are trying to create a psychedelic ecosystem, which means we want to help people on a holistic basis, not only experience benefit from an intervention-based approach with the treatments, but to continue the progress and work towards building emotional wellness and resilience. Because in our estimation, that's where we're going to see the most impact. That's where we're going to see the most engagement. And truthfully, that's where we're going to see the most long-term revenue. Because what we do know with certainty from having been operating for the last 4 years, providing ketamine-assisted therapy, is that the brand relationship and the bond that gets formed between a therapist and Field Trip and our clients is strong and long lasting, and people keep coming back because the outcomes we're generating, the improvements that we're creating for their lifestyle is so meaningful that they want to continue the relationship. They're looking for greater ways to engage with us on a long-term basis. And we see that consistently in the psychedelic ecosystem. And that's how we're creating our strategy going forward for Field Trip. So what is Field Trip right now? We are best known for our Field Trip Health Centers. We've got 9 locations operating across North America, 3 in Canada, Toronto, Vancouver, and Fredericton, and 6 in the US, New York, Santa Monica, San Diego, Seattle, Washington, D.C. And we are generating, as we'll see in the future slides, impacts and outcomes that I truly believe are unparalleled anywhere in the mental health ecosystem, psychedelics or beyond. We have also recently launched an innovative new program that we'll talk about in a little bit called Freedom by Field Trip, which is the first holistic approach to ketamine-based therapy that introduces other modalities. So we help people with the immediate impact of the ketamine therapy, but continue with them on their healing journey over a 12-month membership that we believe will create incredible outcomes. And based on our initial feedback, as the program only launched a few weeks ago, is being extremely well received by the people who are visiting the Field Trip website and hearing about it otherwise. At the same time, we've built the largest psychedelic-focused digital community through our app, Field Trip, the Field Trip app, formerly known as the Trip app. And we continue to build other infrastructure. And so overall, we've got 2 digital platforms, which is our Trip app, as well as our internal EMR, which is called Portal. We've got about 100,000 installs on the Trip app right now. Last quarter, we generated about $1.8 million in quarterly revenues across our 9 locations, 200% year-over-year growth, and one of the best teams in the industry creating incredible outcomes. So, as mentioned, we have 9 operating clinics. We have, without question, best-in-class therapists anywhere. They all come trained from either MAPS, the Multidisciplinary Association for Psychedelic Studies, California Institute for Intercultural Studies, and beyond. As mentioned, we're in Toronto, Fredericton, and Vancouver, New York, Santa Monica, Washington, D.C., Chicago, Seattle, and San Diego in the U.S., with plans to hopefully expand in the near future, with the blue sky opportunities certainly coming, as we see with Oregon creating the first legal market for psilocybin services early next year, actually, in the coming months. Colorado recently having approved 122, which creates a whole psychedelic ecosystem within the state of Colorado that includes psilocybin and psilocin, but other psychedelic molecules as well. We've got Alberta, the province of Alberta, creating a market in and of itself unilaterally and from a political perspective, not a grassroots perspective, and beyond. And certainly we're excited for the potential of MDMA-assisted therapy coming live in early 2024 through FDA approval, and psilocybin-assisted therapy also doing the same. We're expecting that probably 2025, 2026. We know from dialogues with MAPS that MDMA-assisted therapy will be required to be done in clinic. So having the physical footprint that we have with our clinical locations right now is going to be essential for the rollout of MDMA, and it will be essential to have these physical footprints in order to deliver this care, because there are other models out there which won't necessarily be able to participate in this evolution of the market. Even though I apologize. So I was about to speak to our Freedom by Field Trip program, but before that, let me touch on the results that we're seeing. As I mentioned earlier, I genuinely believe that the outcomes we're generating at Field Trip Health are unparalleled anywhere in the world when it comes to mental health treatments. What we are seeing on average is that a client who goes through a 4 to 6 ketamine-assisted therapy program at Field Trip reports significant improvements with significant effect size, on average seeing their depression and anxiety scores going from severe depression and anxiety to mild depression and anxiety. And this graph shows that those benefits go out 4 months. In fact, we're seeing it go out 6 months. So we're seeing almost all patients reporting significant improvements immediately after treatment, and at least half of our patients seeing benefits for up to 6 months going out from the treatment. I'm not aware of anything that comes close to generating these results. When you compare it to conventional treatments with SSRIs, we see moderate to small improvements with no significant effect size. Here we see significant improvements with significant effect size. Like I said, I'm not aware of any treatment that comes close to generating these kind of results. And that's really what's built the brand of Field Trip, is people come in, they generate amazing outcomes, and they tell their friends, and that's how they tell their friends and family. And that's how we've continued to grow. In fact, most of our leads, most of our client acquisition does not come through any kind of digital advertising. It is people looking specifically for Field Trip Health and Wellness. And we can talk about our marketing and awareness in a couple of slides. Even though we are known for our clinical spaces, we continue to innovate in the space. We recently launched Freedom by Field Trip, which, as I mentioned, is a unique, first of its kind, membership-based holistic ketamine therapy program. So it involves up to 12 ketamine sessions that can be done at a person's home or in one of our clinics, that is paired with other modalities such as meditation, sound healing, holistic somatic movement therapy, and other forms of therapy as well. And the idea here is, again, that an intervention-based approach alone to mental health is not going to lead to long-term improvements, that you actually have to make fundamental lifestyle decisions to change your mental and emotional resilience. And that's what this program has been designed to do. And the feedback so far has been incredible. Even though it only launched a couple of weeks ago, we have sold out all of our intake appointments for the month of December, which means even if you wanted to start the program this month, it's a good problem. And a bad problem is that we actually don't have any more clinical slots, because we do have to review everyone's application. We have to make sure it's medically appropriate. And all of our clinician slots have been totally sold out since the first 2.5 weeks that we launched the program. So clearly the engagement and resonance with this program and the messaging is incredibly high. And that we're seeing that the people who who complete the online form to start the process convert at a very high rate. We're seeing a 50% lead to conversion rate, also just validating that the impact of this program, the narrative of this program, is matching what people are looking for in their mental health treatment. We also have our ecosystem. So if you look at most of the studies coming out right now, when you look at the drivers of the mental health crisis that's happening, one of the biggest single factors is isolation and loneliness, and lacking a community of people. And so we built our Field Trip app with that in mind, to provide people with the tools to continue their care after they leave our clinic or complete the program, so they can stay engaged with meditation, music, reading, awareness, understanding, but also really importantly, lean into the Field Trip community, which has now grown to over 100,000 total users through the app, which has grown organically. It, by and large, has lived somewhat peripherally to our clinical operations. But since we spun out from Field Trip Health Limited and became Field Trip Health and Wellness Limited, we've made the app a central part of our thesis because it's a great way to scale and grow engagement and help convert people who may be interested in learning about ketamine therapy or other programs, engage them, and eventually lead to conversion to in-clinic clients as well. So on average, we have about 15,000 active users, and that continues to grow, honestly, just organically. And that's in part being driven by the brand awareness that we've created for Field Trip. So it's almost impossible these days to turn on any media platform or newspaper without seeing some conversation about psychedelics. And Field Trip counts for about 40% of share of voice in the US, which means that 4 out of every 10 mention of psychedelics in any media platform includes a reference to Field Trip. This is significantly larger than any other psychedelic company or organization out there. We are the voice of the psychedelic movement that's happening right now, generating incredible media impressions. You can see where we've been touched on. Just about every major media platform has either interviewed me or one of our therapists or has done a tour of one of our clinics. And that's why almost all of our lead generation is happening on an organic basis. People are actively looking out for Field Trip as a mental health delivery platform. We've invested in doing that. We have our podcast, which is reaching a large audience of people. We're a top 1.5% podcast with about, I think, north of 200,000 unique listeners. And our social media program is very large. So we continue to drive awareness on an organic basis very successfully. One of the things that is lesser known about Field Trip right now is that we're also invested in the evolution of the psilocybin market. One of the first things we did when we created Field Trip back in 2019 was to partner with the University of West Indies to conduct cutting-edge research on psilocybin mushrooms and cultivation, anticipating that markets exactly like Oregon or Colorado would emerge. We certainly anticipate in 2 years, Washington State, Colorado, and other jurisdictions will look to implement similar programs. And we want to get ahead of the curve in terms of innovating on cultivation and different techniques to produce psilocybin in a natural products way. We have recently filed a patent that we expect to be granted fairly shortly about a different cultivation techniques, which can actually create water-based psilocybin from mushrooms. So delivery in a manner that doesn't necessarily have the unpleasant taste associated with psilocybin fungi. And it's technology that's easily transferable, whether into Oregon or Colorado or in the Netherlands. This is technology that can be replicated and know-how that can be replicated across the board. And great opportunity as we continue to build our genetic library in Jamaica to develop new strains, new products, again, as a natural products market and ecosystem rolls out, which I actually anticipate will happen on a much faster basis than we'll see FDA approval for psilocybin from Compass or from USONA. Oops. Just a brief note on the team at Field Trip. I'm the chief CEO and chairman, but our team is a robust team of experienced entrepreneurs within the cannabis and psychedelic sector. Don, our CFO, has been with us for a couple of years. Mujib is one of the co-founders, so he's been here since day one. Stacey Hoyzak is our general counsel. She was actually former chief executive officer of CoinSquare, which is a Canadian-based cryptocurrency platform. I point out Vicky Reed as well. She was the former chief marketing officer at Peloton. So we have a robust team of highly engaged, highly motivated, highly thoughtful individuals running the ship as we continue to evolve our strategy to scale and still deliver incredible outcomes. As noted off the top, we currently trade on the TSX Venture Exchange and on the pink sheets. We do hope that we'll be listed on the OTCQB fairly shortly. That application has been submitted, so we will be officially posted on the QB shortly. Hopefully, we have about 89 million shares. Current market cap is around $10 million or so as the markets have been challenging. But you can see that our cash and cash equivalents means we're actually trading at or just below our cash value. So once again, great opportunity to invest in the leading brand in the emerging psychedelic sector, which is going to be one of the largest, I think, mental health or just health opportunities of the future. So I'm going to stop my presentation at this particular point, and we'll happily jump into the questions that I see are emerging here. So the first question is, what is the cost of a ketamine-assisted therapy per patient, and how much is covered by insurance? So right now, each treatment costs, the in-clinic in-person experience costs between $750 and $1,000 per session, and most people complete about 4 to 6 sessions. So it's typically about $4,000 to $6,000. Right now, in terms of reimbursement insurance, the psychotherapy aspects of it are covered to some degree. So people see anywhere from 10% to about 60% of the cost being reimbursed through their insurance programs. It is individual plan specific, so there's no standard answer to that. But one of the things that is exciting is you may have seen, if you've been following the space, that a company called Enthea recently announced its existence. It's a third-party administrator for ketamine-assisted therapy plans specifically. Field Trip is one of the preferred providers on Enthea. So as Enthea enrolls employers, and they're having great traction in doing so within their TPA, we'll see much more robust insurance coverage for ketamine-assisted therapy generally, but specifically Field Trip as well. So that's an exciting opportunity. We do and are actively working on other insurance coverage options right now. There's not a whole lot to say on that, but it is progressing at I think, a very optimistic clip that will ensure more and more people do have access to coverage for ketamine-assisted therapy, particularly as we can continue to demonstrate the results around safety and outcome. One question is, are we spreading too thin with our operations? And the answer is, I don't think so. All of these things are synergistic, right? They were all built with a single execution in mind, which is it is a constant continuum of care that we are providing. And so the digital components that we've built have actually been built for the in-person experience. We were just able to move them into a digital app as well. And so the continuum of care actually works quite nicely and just takes what we've built and the content that we've been building to support our in-client care and just opens up to a much wider audience of people to ensure that people can stay engaged and actually act as a lead funnel. So I do agree that it is, one does have to be careful in making sure that they don't spread too thin, but actually what we've managed to execute, we've done on a fairly shoestring budget with a very tight, dedicated team, and that continues to execute. Will we continue to do spin-outs at the expense of current shareholders? There's no intent to do any further spin-outs. The strategy, anyone who's been following the story, Field Trip Health and Wellness Limited was a spin-out of Field Trip Health Limited, which was a NASDAQ-listed company. Field Trip Health Limited was now known as Reunion Neuroscience, and we had, which is doing drug development work on its first molecule, and what Reunion expects will be the first next generation psychedelic for approval. As Field Trip Health Limited under the previous entity, we had both the clinical division and the drug development. As we got close to phase 1 trials and work with the FDA, it made sense to separate the two because we saw the synergies that existed from a single company could be maintained through a contractual relationship. So that's what's in place. A lot of data sharing is happening between Field Trip Health and Wellness Limited and Reunion, helping Reunion continue to develop its program, and vice versa. It helps us anticipate where the future market is going in terms of future psychedelic deliveries. But to answer the question specifically, we do not anticipate any further spinouts. Can I speak to the regulatory environment in the US for ketamine treatment, and what are the obstacles to opening new clinics? From a regulatory perspective, ketamine is available both as an off-label option, which is what we use in our clinics. We use the off-label version because it's significantly less expensive. It's a couple dollars per dose. The on-label version is a product called Spravato from Johnson & Johnson. It's about $800 per dose. And what we've seen is that the results from the Spravato are actually less significant than the outcomes from racemic ketamine, which is also less expensive. So that's why we haven't chosen to offer Spravato bravado within our clinics because we can create outcomes with better outcomes with the racemic ketamine and enable more margin and more wallet for additional services as opposed to the actual medicine itself. What are the obstacles to opening new clinics? I think the real obstacles are a fewfold. Physicians have to be comfortable with prescribing. There needs to be a DEA license. And also you need to integrate the therapist. And then there really is an art and a science to having a multi-therapeutic delivery system because we're pairing medicine with psychotherapy. And that's something that we've learned over the last couple of years. In my mind, that's essential to the outcomes that we're generating, which are significantly better than just ketamine IV infusion centers. There are a number of ketamine IV infusion centers, but when you look at the result differential, it's significant. On average, someone who goes for a ketamine infusion without the assisted psychedelic therapy part of it, they have a reversion to mean in about 3 weeks. So they see improvements for about 3 weeks and things go back to normal. As mentioned before, on average, our clients are seeing improvements for 4, 5, and 6 months, significant improvements. So that differential, just the outcomes, I think is one of the biggest competitive differentiators for Field Trip recently. What were the drivers of your 200% year-over-year growth? In part, it was the opening of new clinics, but mostly it was just the ramp up of those clinics. There is a ramp up associated with each clinic. And as our existing clinics have been there, continue to build referral relationships, become more known in the community, both as the medical community and beyond, the client acquisition starts to accelerate and grow. So it's just natural organic growth by and large over the last year. Can you tell us more about the features on the Field Trip app? So presently, the Field Trip app has a number of features. It has music and meditations to support psychedelic experiences or just ongoing self-reflection and self-care. So music, meditations, content, reading, anything that you would want to understand more about how to make the most out of a psychedelic assisted therapy experience, whether truthfully it's in a Field Trip health center or someone in, say, Oregon goes to a clinic and wants to a psilocybin services center and wants to continue care afterwards. There's tools and availability for them within the app, which we will look to monetize probably in the coming year as we build new tools. We do have a very clear strategy for it that we haven't disclosed publicly, so I can't share too much about it, but you'll see the content evolve in a way that makes it much more productive for anybody exploring work with psychedelics. And on the back of that, we'll be able to I think generate a recurring subscription fee for users who aren't necessarily interested or can't come into our clinical centers. There are also tools to record your thoughts and track your progress as well, which I think is instrumental because if you do follow the psychedelic space, you'll know that integration is one of the essential components of these outcomes, which is often people have very profound or transformative insights during a psychedelic therapy experience. But in order to make the most of that, you need to actually make active lifestyle changes to make sure you see those benefits. And so integration and tracking and constantly being reminded about making different decisions in your life is an essential part of the outcomes that we see. And the app is a tool to help drive that. What are the catalysts for revaluation of Field Trip, given that you're trading at cash value? I think you'll just see continued growth. So one of the things that we're excited about and one of the rationales that for launching Freedom is the inherent scalability associated with a Freedom program because it can be delivered at home. Anytime you have a brick and mortars experience, you naturally limit the geography of clients that can actually participate to probably 20 to 30 miles from the clinical location on average. Even though our clinical locations are in large population centers, and so there's a significant number of people who could, in theory, come to the clinic, it does create barriers to access. And so with the Field Trip program, we've taken those barriers away in two ways. One is the cost of the Freedom program is lower than the in-clinic experience. It's $299 a month or about $3,600 for the year versus the $5,000 to $6,000 for the in-clinic experience. So lowering the barrier to entry from a price perspective. And also from a geography perspective, because we can now deliver all the care at home. if you wish, if you're close enough, or if you want to make the journey to come to one of our centers to have the experience in person with a therapist present, that's now an option that's available to you for no additional cost. But it's not limited to only those people who are in the jurisdiction or the geographical range of our clinics. And that's why we're so excited about it. And, we've seen other at-home programs scale quite effectively. And so now we get to leverage the Field Trip brand and our ability to acquire clients on an organic basis as opposed to a paid basis in a model that's inherently more scalable. So that's why we're excited about the Freedom Program. And I think that's going to be one of the big drivers of the revaluation of Field Trip to push us above our current, frankly, trading at cash value level. So I think I'm out of time, but thank you so much for your attention. Any questions, please let me know. I think you have the opportunity to schedule a meeting with me, and I'd be delighted to speak about Field Trip or any of these questions further at your convenience. Thank you, everybody.